As a pelvic health physiotherapist, I want to talk about something really personal, something that so many women deal with completely in silence. So today, let's talk about painful sex. We're going to get into why it happens, and more importantly, what the path to recovery looks like. First, let's just start with this number, 3 in 4. Yeah, you heard that right. The medical term for pain during or after sex is dyspareunia, and it affects up to 3 out of every 4 women at some point. If this is you, I really need you to know that you are so far from alone. And this is probably the single most important thing you'll hear from me today. It is incredibly common, yes, but it is never normal. Pain is your body's way of telling you something isn't right, and I can tell you, there's almost always a treatable reason for it. Okay, so where do we start? Well, the very first, most crucial step is to really get a handle on the specific type of pain you're feeling. This is what helps us start to play detective and figure out what's really going on. So as I said, that medical word is dyspareunia, but honestly, that's just a big, fancy term, and it can cover a whole range of very different experiences. So let's actually break down what those can feel like. Okay, so take a look at this. Does any of this sound familiar? Is it that sharp burning or stinging feeling right at the entrance, when penetration begins? Or is it something deeper, more like an ache or pressure deep inside your pelvis? Or hey, maybe it's not even during sex, but this cramping or soreness that just hangs around after you're done. Just identifying which one of these fits you is a huge first clue. And that leads us naturally to the next big question. Once we know what it feels like, we have to ask, why? Why is this happening? Let's explore some of those underlying reasons. And the truth is, the causes can be all over the map, and often they're all tangled up together. There can absolutely be physical conditions causing it, but our emotional well-being plays a massive role too. So if we look at the physical side of things first, wow, there's a whole list of potential culprits. It could be something temporary, like a yeast infection, or it could be related to hormonal changes, after having a baby or during menopause. Sometimes it's a condition like endometriosis. But honestly, a huge amount of the time, the root cause I see in my clinic is tension, just overactivity in the pelvic floor muscles themselves. And this is so important because it's never just physical, is it? Think of your nervous system as the hotline between your brain and your body. When you're stressed or anxious or carrying past trauma, your body responds. And one of the first things to do is clench those pelvic floor muscles, often without you even realizing it. That kicks off this vicious cycle of pain, which then makes you more anxious about sex, which leads to more pain. Okay, understanding the why is really important, but I know what you're really here for. You want to know, how do we fix it? So let's get into that. Let's talk about the pathway back to intimacy that feels good. So right off the bat, there are some wonderful things you can try, and please don't underestimate how powerful these can be. Talking openly with your partner, that's huge. A really good quality lubricant can be an absolute game changer. And just exploring, different positions or making sure there's plenty of foreplay, these simple things can make a world of difference. But, and this is a big but, for a lot of women, those strategies are more like Band-Aids. They help manage the symptoms, but they don't always get to the root of the problem. For lasting change, especially when there's real muscle tension involved, you often need a more targeted professional approach. And that is exactly where a pelvic health physiotherapist, someone like me, comes into your recovery story. We're specifically trained to be detectives for your pelvis, to figure out and treat the muscle and nerve issues that are causing the pain. I want you to picture your pelvic floor for a second. It's like a muscular hammock that sits at the base of your pelvis. It's vital for everything from bladder control to arousal and orgasm. But imagine if that hammock was just pulled banjo string tight all the time, what we call guarding. Well, of course, that's going to be a primary source of pain. So the process is really a journey that we take together. It always starts with a very thorough assessment, just to understand your unique story. From there, we might use gentle, hands-on therapy to release those tight muscles. We have amazing tools like biofeedback that can help you actually see your muscles relax on a screen. We always work on breathing and calming the nervous system. And the end goal is always to empower you with a personalized program you can do at home to keep the progress going. I really want to emphasize this because I know people can be nervous about coming in. Our treatment is always gentle. It's never forced, and every single step moves at your pace. You are in control. Honestly, the words I hear most often from women are relieving and empowering. It's about feeling safe as you reconnect with your body. So after all of that, what's the big takeaway? What's the one thing I really hope sticks with you after you're done listening? Please hear me on this. Living with this kind of pain is not a life sentence. It is not something you have to just put up with. Taking that first step, making that call, booking that appointment, it's a truly transformative act of self-care. It can change everything. So if you are ready to restore comfort and confidence and that feeling of connection, please know that help is absolutely available. Thousands and thousands of women have found relief, and a professional who's dedicated to this work can help you do the same. You deserve intimacy that's about pleasure, not pain. The sooner you start this journey, the sooner you can feel that relief. We're here for you whenever you're ready to take that first step.